Seniors Living Well with your host, Laurie Webb.
Hi everybody, welcome back to today's Seniors Living Well. Make 2013 your lucky year. We've been talking about a number of aspects of one's life that we need to look at to be proactive and make our own luck as we get older. We just spent the first half of the show talking about Medicare and Medicare fraud and finding out about how we ourselves can be proactive and help prevent, reduce Medicare fraud, and how we can get enrolled in Medicare if you need to be enrolled in Medicare. We're going to be moving on to something that Medicare doesn't cover, which is dental care. Last year, we had a nursing student from the Betty Irene Moore School of Nursing at UC Davis, and Anita did a program on blood pressures, and she came on the show and talked a little about that. And we had so much fun with Anita that I told the school we'd be happy to have students back anytime. So we called a community meeting together. We were told, yes, you can have students, and we called a community meeting together of a number of local service providers and people that are on the oral health task force joined us, and we kind of brainstormed what we would like to have the students do a project on, and several things came floating to the surface, one of which was mental health, and we thought, well, that'd be a little overwhelming. We're all overwhelmed with mental health services. But the thing that has kept coming up and came up with the national needs for seniors is dental care and oral health, because Medicare does not cover any aspect except some oral surgeries. So we said that's what we'd like our students to work on. And lo and behold, we got two students, one of whom's with me today. Hi, Monica. Thanks for coming
Hi,
up
Laurie.
so
Thank
early.
you so much.
Monica Miller is, you're in the master's program.
I am.
And her partner, Jay Preet, who can't be here with us this morning, have been working on a very interesting project. So now you're a nurse. You already have your nursing license and your bachelor's degree.
I do. I'm currently a critical care nurse.
Critical
by
care.
trade.
Okay, so that's a far cry from oral health, right?
It is a far cry from oral health.
So tell us a little bit about what you and Jay Preet thought when you were told, we'd like you to look into dental care.
So it was really interesting because, you know, obviously this is not what my background is, but coming to this community has been absolutely amazing. It's just been such a wonderful experience, not having prior community health experience to this degree. And one of our first interactions when we met at the Oral Health Task Force was looking at the amazing interagency collaboration. I'm just so blown away. And you know, your community is such a model. I mean, statewide, nationwide. And every time I come, there's one more thing that just reinforces that. It's absolutely amazing. So, you know, from that, everybody has greeted us warmly and been helpful and given us nothing but, you know, support in anything that, you know, we've asked or needed. One of the things that really comes through is your community connectedness and how each of the agencies, you know, particularly looking at the Oral Health Task Force, how there's so many different agencies that are looking at community problems across the lifespan in terms of oral health, and thinking of, you know, from pregnancy all the way through the lifespan to seniors. It's really incredible.
Yeah, that Oral Health Task Force is quite a good representation of a number of the kind of health coalitions that we have. And I hadn't really been involved with them before. Eileen, my assistant, had gone to a couple meetings, but you know, since you guys have been up here, I've been in the loop, as it were. And now, one thing we tried to hook you and Jay Preet up with a couple local dentists to talk to them, and that didn't work out too well. But the dental hygienists at that meeting, they were full of ideas for you guys.
Absolutely.
So
yeah, absolutely.
And then maybe talk a little about the follow-up that you did here in the community, like the day you came to the senior center.
So we actually we developed a survey tool and kind of an educational template based on some feedback from the Oral Health Task Force, and my partner Jay Preet and I we did some research online and kind of found out some, national health goals related to oral health, and we looked at some information from the American Dental Association, AARP, and some other organizations to find out kind of where our national health goals in terms of related to oral health.
So there were actually national health goals?
There are national health goals,
cool.
yes,
Start.
absolutely, yes. And so with that, we also worked with the task force on some, okay, what would you like to talk to seniors about? Because we, the task force identified seniors as a population that was could directly benefit from some of our efforts, but we really kind of sought to find out, well, what do the seniors think? And so we went to the senior center and we interviewed 12 seniors over a 2-day period. It was absolutely wonderful.
You got
great
some
group of
talkers
people.
too,
We
didn't
did
you?
get some talkers. It was so much fun, and we're so grateful to the people who participated. But one of the things that we sought to find out was, do seniors really know how important oral health is in terms of connection to systemic disease? And what we found out is that most of them do. It was great. Only one person kind of had a question, and it was an aha, oh, wow, I didn't realize that, for instance, diabetes can show up in your mouth, as one of the first signs. But it was really interesting thinking about the well, I think seniors are a particularly vulnerable population. You're looking at the multiple medications they take, missing teeth, all those kinds of things can really affect nutrition, quality of life, self-esteem, social interactions, and so it's really, a unique population to focus on. And unfortunately, a lot of our efforts, nationwide, community-wide, have been directed towards the younger people.
Toward the kids,
That's
yeah.
exactly right.
Yeah.
So some of the things that we, were kind of concerning areas to us were that 7 out of 12 people that we spoke with had some kind of a dental problem or oral health problem.
7 out of 12 of the folks.
7 out of 12, and these are
Yeah.
people who could come to the senior center, socially connected, active people, and these were problems anywhere from missing teeth in their dentures, as far as abscesses, infections, things like that. And another significant thing was that 5 out of 12 of those people were living with pain that we spoke with.
Goodness.
Yes,
Just
such a huge
had dental
general
pain.
yeah, and 3 of those people who had that pain did not have insurance, dental insurance. 6 out of the 12 people, so 50% of the people we spoke with had dental insurance, so
Oh,
that was
really?
really encouraging.
Yeah.
But 50% did not.
50%
6
did not. Yeah.
Right, and
Yeah.
so one of the things that we anticipated hearing was a concern about transportation, and that was validated. But considering that we spoke with people at the senior center who were, able to get to the senior center, 2 of those people that we spoke with reported transportation as a personal barrier for them accessing dental services. But they all identified, the access issues as a community-wide issue.
Right. So it's not just the financial
Correct.
access, it's access because of not being able. Because it's one thing to be able to get to the senior center when the person that lives next to you in the apartment building is going to play bingo. I think you came on a bingo day.
We did,
Yeah, and there's a lot of carpooling that goes on around the bingo stuff. But so you went over the survey with these folks, and the results that you found you're going to be presenting to your teachers. And also coming next week to the Commission on Aging
Exactly,
meeting?
the
Okay.
Oral Health Task Force. And one of the things we hope is that it can be kind of give some feedback for future efforts at improving access or looking towards programs. One of the other things that we're working on that's been kind of ongoing throughout the program is working to provide the community with a list of things that, okay, we've spent a lot of time looking online. What do other communities do that have these similar types of issues? Is there services that we can access from Sacramento, from Stockton, and other kinds of things. Unfortunately, a lot of resources that we've explored are closed because of waiting lists or closed due to funding, and so that's been quite the challenge.
Yeah, and just the whole focusing on prevention and
Absolutely.
Because when we talk about seniors, we're talking about people 60 to 106. So there was a broad spectrum of where people are in the evolution of their dental health. So this should be a wake-up call to people that still have good teeth, because most of us baby boomers got good dental care, and a lot of the folks that you talked to were older, right? Did you do an age?
We did not.
Okay.
Yeah, we did not.
Yeah.
There were some things that we thought, in hindsight, and so looking to, perhaps the next group that comes through to, talk with some seniors up country or, from different socioeconomic and geographic, areas. But one of the things that we also think, and the Oral Health Task Force agrees, is that we think that, primary care providers, it would be really nice to encourage conversation with primary care providers, especially considering that, 7 out of the 12 people that we talked with had some kind of problems. So, and only one person that we spoke with had conversations with their primary care provider about
out
oral
of
health.
12 people,
Out of
only
12.
one
Only one.
had a doctor who looked in their mouth. Wow.
Yeah.
That's amazing. So one of the proactive things you can do when you go to see your doctor, if you have dental pain, is tell them about it.
Absolutely.
And I know probably the response is going to be, well, they can't do anything about it because I don't have dental insurance. But still, they need to know.
Absolutely.
Yeah.
And if you have an infection that could be treated with antibiotics, and it's something that, maybe it's, affecting what you're eating. You're not chewing hard food, so fruits and vegetables you're avoiding because it hurts when you chew. So therefore, you're nutritionally compromised, which, obviously affects you.
Affects a lot of things.
Exactly,
Yeah,
exactly.
true.
So it really is, it's not, dental care separate from health. It's really your health.
Yeah.
It is, and it just creates a more holistic picture.
So now you're a critical care nurse, so a lot of times your patients have something in their mouth already.
Absolutely.
So what kinds of things did that change your practice at all?
It's really made me more aware, and it's really in terms of my discharge teaching with my patients or transfer, and talking with, even talking with my own mom, and she has great oral care, but I think it's really given, it's given me a fresh perspective, and it's really, allowed me to stress the importance of that, because people who have, in my line of work, one of the things we really worry about is pneumonia is associated with, poor dentition and oral health and things like that.
Well, Monica, thanks for getting up early and coming up here, and
thanks for having
we're
me.
going to go to the break and then talk about transportation and what we have available. So stay tuned to Talk with Robin.